This internship was a really great experience for me. It gave me a lot of insight into multiple fields of medicine that I hadn't previously considered before. So, for instance, I went and shadowed a family practice resident and a few other physicians, and I learned that I am actually pretty fond of the clinical setting and meeting with one-on-one with patients and building these like interpersonal relationships. So it's been a great experience for me. It's really taught me a lot about myself. It's taught me a lot about the field, and I'm really appreciative for all the experiences that I've had in it.
You know, it isn't always what you see on the surface as a patient, so be able to stand behind a doctor and be like, oh, this is actually what they do. They actually look at your chart. They take the time to know you and know your medical history in the past and things like that. So without being able to do this, I, as a patient myself, wouldn't be able to understand what they do. And being able to see what they do actually behind the scenes has been probably one of the most enriching things of this internship.
I'm more passionate about wanting to help my community. Before I started this internship, I just wanted to help out, but now I just grew into having a greater passion for it, wanting to help the undeserved minorities that mostly live in this area.
There's a big Hispanic population out there, and sometimes I've seen how they struggle to find translators, and the patient can't really communicate as well with the doctor. So I'm more passionate about becoming a doctor, just to be able to help not only the Hispanic community, but anyone I really can.
Most people don't get to see stuff like this every day. I mean, you go to a hospital if someone gets sick and you just hear about what the doctors say, but you don't actually get to see like the many patients they see from day to day. I was most surprised by a patient. He was fully conscious and he was just having surgery and playing a video game, like nothing was happening.
Most interesting experience I had in my internship was walking into an operating room with Dr. Eby, an anesthesiologist, and immediately seeing a nurse performing a DNC on a patient who had just given labor. I was shocked at the moment. I had to do a double take because we were going in to deal with putting the patient under anesthesia and not really worrying so much about the procedure, but I had no real choice but to just watch. And it was very intriguing to me because just the day before I had read an article about how DNCs are becoming an increasingly risky procedure as they lead to incredible high risks of infection where you have to use an incredible amount of antibiotics for the woman who has just gone into labor. And for a new mother to be on a lot of antibiotics means that she cannot nurse her child. So there was a lot going on in my brain and there was a lot going on in the room. So that was definitely an experience I'll take with me for a long, long time.
I was most surprised by how calm and collected women were going into OBGYN. I always thought that was going to be something that was, they'd come in nervous or maybe didn't want to be willing enough to talk to the doctors. So that was definitely surprising to me to see that.
I don't know, I had so many. I saw like a pregnant lady who was like really big, and I got to see, babies through the OBGYN and got to hear their heartbeat. But probably the most, craziest thing I saw was at the hospital when this lady had jaundice and everything was just yellow, her eyeballs, and it was just yellow.
The most interesting experience was with Dr. Eby, and that was in the OR. He is an anesthesiologist, and we literally walked from OR into OR. It was pretty interesting, weird, but cool at the same time that we had the chance to do that because, no one ever just gets to walk from OR to OR just casually unless you're actually a doctor or a nurse or something that's performing it. So it was nice to get that.
Dr. Bernstein showed me that you can be a physician and you can be an activist, and those are two things that I am extremely interested in. So not only is she an activist for closing the health disparities and the health gaps within the minority communities, such as the African American community or the LGBT community, you can also be an incredible physician and meet with all types of patients, regardless of their background, and try to give them excellent medical care to the best of your ability. So I really appreciated getting to spend time with her, doing rounds in the hospital. We met with a variety of patients, and with each of the patients I saw that she upheld incredible standards and was an incredible example to look at for me and moving into the future when I become a physician to reference back.
Rebecca Bernstein, because every time I would go and rotate with her, she always had something new going on with each patient that we would go visit. It was a new case, and it was never the same with her.
Dr. Evans inspired me because even though she would have a language barrier between some of her patients, since she would get most of the Hispanic population, she would still learn, go out and find out, how to pronounce some words or even other treatments that would help the patient in a more efficient way, but she would never reject giving care to them. It just inspired me because even though there were she faced some challenges throughout, she would still keep going and give them the best care, which is something I would want to do once I become a doctor.
I'd have to say Dr. Vickery. I really loved his way of speaking to patients and the relationships he built over the years of, working in his practice. He knew about your sons and your daughters and your family as a whole, and that's definitely something that I want to carry on throughout my career and throughout my life.
Helped me through this program a lot was Kirsty Connor, because there were times where I was like, I can't do this, I don't want to be here, and she'd be like, no, you have to, you can do this, and she would just kind of push me to the best that I can be, and so I'm really grateful for her, because without her I probably wouldn't have finished this internship.
I am definitely most grateful for my preceptors and Miss Hallam and Kirsty Connors. I would not have been able to get through this without them. So definitely their support and the willingness of my preceptors and them teaching me, I'm most grateful for.
I'm grateful for all of the work and energy that was put into organizing and planning and faxing and scanning for all of the scheduling for this internship. There's a lot of preceptors, there's a lot of interns, there's a lot of communication that needs to happen for this to run effectively and for me to be able to show up at a preceptor and have a good shadowing window. So I appreciate all of the hard work that people like Kirsty Thompson and Jacqueline Hallam and any other person who's put in hours and hours of work into the Minority Medical Mentoring Program, including the board and the selection committee. They're very passionate about this, and I really appreciate that there are people who are looking out for us and trying to give us opportunities and experience that they didn't have when they were our ages. So,
I would just like to say thank you to Kirsty and Ms. Hallam for giving me this opportunity to be able to see this and to broaden my view of health professions.
To Ms. Hallam and Kirsty, I just want to say thank you for giving me the opportunity to go through this internship again. It definitely was not the same experience as last year. It was nice to get the experience in the office and doing some of the paperwork and even helping setting up the internship for the other interns. It was nice to do that and getting to work with you more. I'll be sad to be leaving, but thank you.